Good afternoon. My name is Sarah Boyd, and I'm the president and founder of Operation Truth Vaccination Exposure Research, a 501c3 charity built to bring awareness to our vaccine-injured patient demographic and the need for medical research. The last few weeks, we have shared videos of how autonomic neuropathy, Raynaud's phenomenon, and lymphedema presented throughout my body. How I was able to successfully present my root cause analysis to the lead medical researchers to determine my cause to be from a vaccine injury. According to the Mayo Clinic, endometriosis is an often painful disorder in which tissue similar to the tissue that normally lines the inside of your uterus, the endometrium, grows outside your uterus. Endometriosis most commonly involves your ovaries, fallopian tubes, and the tissue lining your pelvis. Rarely, endometrial-like tissue may be found beyond the area where pelvic organs are located. With endometriosis, the endometrial-like tissue acts as endometrial tissue would. It thickens, breaks down, and bleeds with each menstrual cycle. But because this tissue has no way to exit your body, it becomes trapped. When endometriosis involves the ovaries, cysts called endometriomas may form. Surrounding tissue can become irritated, eventually developing scar tissue and adhesions, bands of fibrous tissue that can cause pelvic tissues and organs to stick to each other. Although the exact cause of endometriosis is not certain, possible explanations include retrograde menstruation, which in retrograde menstruation, menstrual blood containing endometrial cells flows back through the fallopian tubes and into the pelvic cavity instead of out of the body. These endometrial cells stick to the pelvic walls and surfaces of pelvic organs, where they grow and continue to thicken and bleed over the course of each menstrual cycle. Transformation of peritoneal cells in with what's known as the induction theory, experts propose that hormones or immune factors promote transformation of peritoneal cells, cells that line the inner side of your abdomen, into endometrial-like cells. Another theory is that embryonic cell transformation, where hormones such as estrogen may transform embryonic cells in the earliest stages of development, into endometrial-like cell implants during puberty. Surgical scar implantation, where after surgery such as a hysterectomy or C-section, endometrial cells may attach to a surgical incision. Endometrial cell transport, where the blood vessels or tissue fluid in the lymphatic system may transport endometrial cells to other parts of the body, or where the immune system has a dysfunction, and a problem with the immune system may make the body unable to recognize and destroy endometrial-like tissue that's growing outside of the uterus. In my case, the director of the War-Related Injury and Illness Study Center, Dr. Ashford, determined during my root cause analysis evaluation that back in 2007, I had several vaccinations in anthrax, smallpox, and several others in preparation for deployment to Korea. Soon after, endometriosis developed. Severe pain led to medical diagnoses through laparoscopic surgery, which was confirmed in 2008 and 2012. However, it is unclear how endometriosis developed. Unclear if development of excess estrogen production was the cause. Unfortunately, we won't know unless we have proper medical research to determine which vaccines are causing these cellular damage. In an NIH study conducted in September of 2022, titled "The Effect of SARS-CoV-2 Vaccine on the Symptoms of Women with Endometriosis," reports on menstrual changes have arisen. They aimed in the study to examine menstrual bleeding patterns and endometriosis-associated symptoms after receiving the COVID-19 vaccine in women with endometriosis, as compared to the control group. In their cohort, endometriosis was shown to be a significant risk factor for worsening of menstrual symptoms after receiving the COVID-19 vaccine. Of course, further research is needed to confirm these findings. Another study in November of 2013, conducted by the Fred Hutchinson Cancer Research Center, found that 2 organochlorine pesticides are associated with an increased risk of endometriosis. Specifically, researchers observed that women with higher exposure to 2 such pesticides, beta-hexachlorocyclohexane and Mirix, had a 30 to 70% increase in endometriosis risk. Since endometriosis is an estrogen-driven condition, they are interested in investigating the role of environmental chemicals that have estrogenic properties, such as organochlorine pesticides, on the risk of the disease. Again, without further research, we may never know if my endometriosis was caused by the vaccines or other toxic exposures given during my military service. Which is why vaccine injury research to determine diagnostic and treatment protocol is so important. In the absence of a proper treatment and diagnostic protocol, conducting a root cause analysis is the next best tool. Operation Truth is conducting a series to show our fellow chronic multi-symptom illness patients how to conduct your own root cause analysis. If you're interested in learning more about your own health journey, then send an email to the contact listed on your screen. Any toxic exposure can cause chronic illness. It is imperative that you conduct your root cause analysis to determine the proper form of detox and proper diagnostic and treatment protocol. Without further research, our patients who are vaccine injured or are suffering from toxic exposures, cellular damage, may never know how to properly treat or heal from their toxic exposures. That is why we fight. Thank you for your support. Don't forget to subscribe and have a great week.